an ectopic pregnancy. Gerald Massa, the fertility educator, is the name of the channel. I welcome you. If it's your first time, remember to subscribe so that you do not miss new videos we release every day. Sanyusa nnyo mukwano gwange nkwaniriza ku channel yaffe Gerald Massa, the fertility expert. Ku channel yaffe eno njogera ku butya bw'osobola okubanga ofuna mangu olubuto gwe mukwano gwaffe oba mmwe abagezezaako okubanga mufuna olubuto naye nga bikyabalemereddwe mutambudde eddwaliro ku ddwaliro mulemereddwa okubanga mufuna amangu okubanga omukyala afuna mangu olubuto. Kweno channel at least ojja kufunayo ko video emu oba bbiri ezijja okubanga zikuyamba olabe nti at least journey oba olugendo lw'okubanga mufuna mangu olubuto lubeere nga lwanguwa nga mumaze okutegeera kiki kyennyini ekituufu ekigenda mu maaso. So we are discussing about an extrauterine pregnancy, commonly known as an ectopic pregnancy. Have you been asking yourself, you've done the scans, you've done the pelvic ultrasound scan, and your doctor is telling you that you have what we call an ectopic pregnancy, and you are asking yourself, what could this mean? What is an ectopic pregnancy? In this live stream, we are going to discuss everything. So when you do an ultrasound scan and then it shows you that you are having an ectopic pregnancy, first of all, we need to understand that when fertilization happens, it takes place in the fallopian tube, specifically in a part known as the ampulla, which is actually the finger-like part of your fallopian tube. And remember, the fallopian tube is what transports the fertilized egg to the uterus, where it will implant and then it will grow. Mbadde ndikwogera ku ectopic pregnancy era ngambye nti gwe weena agezezaako okubanga afuna olubuto ng'omukyala naye nga bikulemeredde buli lwofuna olubuto bakugamba olina ectopic pregnancy. Kino kiba kitegeeza nti omwana mu kifo ky'okubanga abeera munabaana muli munda, omwana mu kifo ky'okubanga akulira muli munabaana munda, omwana akulira wabweru awanabaana. Kino kye tuyita extrauterine pregnancy. Kibi nnyo kuba kisobola okuba nga ate kivaako embeera etali nnungi, kuba ate kisobola okuleeta n'okuba nti obulamu bwo bubeera mu matiiga. We are proceeding with our live stream. We are discussing about an ectopic pregnancy. And remember, if you do have questions for me about what we are talking about, specifically just go in the comments and then post your question. I will answer your question, advising you on how you can get pregnant faster. An ectopic pregnancy is our topic for today. So ngambye nti wobanga obadde ogezezaako okubanga ofuna olubuto naye nga ate okoze scan bakugambye nti wafunye olubuto naye nga ate olubuto lwagenze mu nseke, kino kiba kitegeeza nti wandeetaagisa okubanga olaba dokita wo okubanga akubuulira ekiba kiddako. How can you tell that you are having an ectopic pregnancy? First of all, we've said that an ectopic pregnancy means that the pregnancy is outside the fallopian tube. The only way to confirm that you are having an ectopic pregnancy is you will actually begin by experiencing. First of all, before we talk about the confirmation, before we talk about the confirmation of an ectopic pregnancy, we shall begin by talking about the signs of an ectopic pregnancy. The signs to show that the pregnancy is not in the uterus, the pregnancy is outside the uterus. Tuli kwogera ku signs eza ectopic pregnancy. Era ngambye nti the first sign of an ectopic pregnancy is that you as a woman, you are going to miss your periods. Okay? When you miss your periods, it is an indication that you could be pregnant, but it could also indicate other things. The second thing, or the second sign you are going to experience when we are suspecting that you could be having an ectopic pregnancy is you are actually going to have sharp pain which is localized on one part. The sharp pains could be on your right side, also known as your right adnexal region, or it could be on the left side. Tugambye nti sign esooka ey'omukyala afunye olubuto olw'omunseke oba kye tuyita ectopic pregnancy y'eyokuba nti first of all agenda ku missing periods. Okay, omukyala afunye ectopic pregnancy ojja kufuna signs zonna ez'olubuto zezimu zendi okwogerako nti ojja ku missing periods zo. Obadde osuubira okulaba periods zo guno omwezi naye n'otaziraba, obadde osuubira kulaba periods zo guli omwezi ogwaweddeko naye tewazirabye, ogenda okukola ka test ak'omusulo ke tuyise ka urine HCG pregnancy test, ogenda okakebera kalaga nti olubuto mwe luli. Ogenda okukola scan naye ate dokita wo ng'akugamba nti nedda, scan tuligikola naye ng'ate n'abaana nkalu, naye waliwo akasawo kaali okulaba akali mu nsonda either ku side eno eya right oba ku side eno eya left. Ako kalaba akalinga akasawo lwandibanga lwe lubuto oluli mu luseke. Jjukira leero live yaffe tugikoze nga twogera ku olubuto oluli wabweru wa n'abaana kye tuyita ectopic pregnancy oba badokita abamu bakiyita an extrauterine pregnancy. Obanga obadde olikulaba video no ng'oligiraba mu replay nga wamisinze live yaffe eyabaddewo leero, gezaako okulaba nga ogyetegereza yonna paka wegenda okugwera, ojja kuba oyiga ekigambo ectopic pregnancy kitegeeza ki. Next time dokita wo akugamba nti omwana ali wabweru wa n'abaana, ojja kuba ojjukira nti yes, musawo Gerald yakyogerako era kyekino kyennyini kituli okwogerako ku ssaawa zino. Kati woba omisinze periods zo nga twalabye periods zo, ate n'ekirala n'otandika okufuna signs ez'olubuto, otandise okuyoya obuyembe, otandise okuwulirako eggamba ng'oli lubuto, okoze ka test ak'omusulo kakulaze nti oli lubuto naye lubuto lugenda mu weeks 8 gy'emyezi ebiri naye ate ogenda okulaba nga toli kulaba kweggamba mwana ali kukola mu n'abaana, bakoze scan naye nga scan eraga nti n'abaana nkalu, kyandibanga olina kye tuyita ectopic pregnancy. If you have done the tests, let's assume you've done the urine HCG pregnancy test, the home pregnancy test whereby you get a small strip and then you check in your urine to confirm whether you are pregnant. You've done the pregnancy test and it is showing you that you are pregnant, and then you have gone ahead and done the pelvic ultrasound scan and it is showing you that actually you are not pregnant, but you are having some small swelling in the fallopian tube, either the right fallopian tube or the left fallopian tube. That small swelling is what we call the gestational sac, and it is a confirmation of an ectopic pregnancy. Baby growing outside the uterus, baby growing in the fallopian tubes. What can you do to prevent this from happening? We always advise all women to make sure that you actually stay away from alcohol. When you take lots of alcohol, when you take lots of cigarettes, you smoke lots of cigarettes, there are high chances that they could predispose you to an ectopic pregnancy. The next thing is that always and always, whenever you have any discharges coming from your private parts, make sure that you do go to hospital or to your nearby health facility where your doctors will run some tests. The first and the most commonest test that will be done is the urine analysis test, which will actually help the doctor to identify whether you could be having an underlying urine tract infection. And if at all it is discovered, always and always make sure that you get treatment very fast. The main reason why I'm telling you to get treatment very fast to prevent ectopic pregnancies is that when you have these urine tract infections and then they are not treated on time, there are high chances that they could predispose you to ectopic pregnancies, amongst other things. Actually, poorly treated urine tract infections can even predispose you to pelvic inflammatory diseases. Mbadde ndikogerako neŋŋamba nti butya bw'osobola okubanga oziiza okubanga ofuna zino infections, era ŋŋambye nti gezaako ennyo okulaba nga oyogera ne musawo wo akole test ey'omusulo gye tuyise urine analysis test, ejja kuba eraga biki ebiri mu musulo gwo. Mulimu obukyafu, temuli bukyafu. Singa dokita wo azuula nti omusulo gwo mukyafu nnyo, gulimu amasirasira, gulimu okwegamba embeera etali nnungi, dokita wo ajja kuba akuteeka ku treatment, era treatment eno geza okulaba nga ogigoberera ogimaleyo, nebbaawo alina okuba nga afuna treatment. Bwe muba mwena mufunye treatment nemuba nga mujjanjabiddwa obulungi, chances nnyingi nnyo nti ojja kuba osobolera ddala okuba nga ofuna olubuto. The only way to prevent ectopic pregnancies is get yourself treated very fast. Do not wait for something to progress and then you think about treatment. Always get treatment very fast to prevent this from increasing. So, Tuliko, we've been talking about an ectopic pregnancy, and specifically, I believe at this juncture, at this point, you now know something about an ectopic pregnancy and how you can prevent it. But if at all the implantation, or I mean, if at all the gestational sac, the baby sac, has already started growing in your fallopian tube, then it means that there's nothing that can be done. The only option which would be remaining is to undergo a special operation in theater, which is called the The operation which is done is actually called a salpingectomy, whereby your fallopian tube will be operated on by your doctor. But still, you can always discuss more with your doctor about this operation I've just said, which is called the salpingectomy. And then there could actually be more advanced procedures which could be done on you, depending on your country of origin. If you are in the first world countries, that is, if you are in the US, in the UK, and in Europe, there are newer procedures which would be done on you. For example, the new keyhole surgery, which will actually be done on you, but with minimal damage being exerted on your parts. So you need to discuss this with your doctor about the available options for treatment or for surgery. Webale nnyo mukwano gwange okwekumira ku channel yaffe mu live yaffe neya leero togedde ku ectopic pregnancy. Woba obadde olina ekibuuzo kyonna kyonna kyoyagala okuba nga nkuddamu, making sure nti ogenda wansi mu comments okiteekeyo, nja kuba nkuddamu. Remember, subscribing obeere nga tomissinga videos zenteekayo buli kanaku. Remember to subscribe so that you do not miss new videos I release every day about fertility, about reproductive health. Thank you, and let me see you in tomorrow's live stream. May God bless and protect us all. Bye-bye.